अभी प्रेगनेंसी और मदरहुड के लिए प्रेपरेशन तो होना चाहिए, यू ब्रिंगिंग इन अ लाइफ। ठीक है,
हम्म,
हम कोई भी मीटिंग में जाने के पहले भी प्रिपेयर करते हैं। तो अगर सबसे कॉमन इश्यू दैट पोस्टमार्टम ममास कम विद इज ना कि
हम्म,
प्रेगनेंसी में जितना केयर और प्यार मिलता था
हम्म,
पोस्टमार्टम में वैसा नहीं हुआ है।
ओके।
सो इट्स इम्पोर्टेंट टू अंडरस्टैंड कि हम कैसे फंक्शन हमारी बॉडी करती है। नॉट इंटरनेट, इट कैन हैव अ लॉट ऑफ मिसलीडिंग इन्फॉर्मेशन। बहुत सारा इन्फॉर्मेशन मिलेगा, बहुत डराएगा, बहुत ट्रिकी इन्फॉर्मेशन होगा।
गुड।
हम्म।
सो व्हाट एग्जैक्टली हिप्नोबर्थिंग लाइक, क्या होता है एंड कैसे किस तरीके से वो हेल्प कर सकता है, इवन इन स्ट्रेस लेवल्स?
राइट। एंड मोर देन एनीथिंग, सिंपल थिंग, आप सिर्फ चाइल्ड बर्थ एजुकेशन भी करेंगे अगर प्रेगनेंसी के टाइम पे, देयर आर मेनी क्लासेस एंड नॉट जस्ट योगा क्लासेस, प्री नेटल क्लासेस आर जस्ट आर डिफरेंट फ्रॉम योगा क्लासेस।
And today we are having a conversation around emotional well-being during pregnancy and after childbirth, because we know that becoming a mother is a beautiful journey, but it also comes with a lot of challenges. And mostly we consider about the physical challenges, and it's not uh, talked about much about the mental and emotional
Yes. Okay.
challenges. So today we have a guest, Miss Paulomi. Thank you so much for joining, Paulomi.
Thank you so much.
Yeah. So Paulomi is a psychologist and a hypnobirthing coach, and she has a 12 plus years of experience in guiding mothers during pregnancy and after childbirth. So today she will help us understand the challenges and a little bit she'll address on the issues. So before we continue with we start with our conversation, follow me. I would like to know a little bit about you, your work, and how is it going?
Okay.
Yeah,
Okay. So thank you, Shivani. I'll just tell you what exactly I do. So I'm a
yeah, sure.
psychologist. Okay. I majorly work with mamas.
Mm-hmm.
So what you're talking about is actually the perinatal phase.
Yeah,
Pregnancy से postpartum तक. Okay.
postpartum tak.
Postpartum is just ideally people say it's like the first year after a child is born.
Mm-hmm.
So that whole phase is what is considered something which is very different and transitional for mothers.
Mm-hmm.
So that's my area of work, and I support them through education also,
Mm-hmm.
and by providing one-on-one therapy sessions when it comes to managing their lives with
Mm-hmm.
different challenges in this period, be it pregnancy or postpartum.
As you mentioned that you work with group as well as one-on-one
Hmm.
sessions
Hmm.
for like for pregnant
Hmm.
women and also childbirth. So let's start with the pre prenatal, like before the childbirth, like
Okay.
pregnancy part. So
Okay.
how does this group therapy session helps? Like, I would like to know about that as well.
Okay. So, group sessions usually are more about, it's more like a support kind of a system
Mhm,
that is done,
mhm.
where we are focusing on prepping up for pregnancy. Sometimes there are discussions on people who are still undergoing conception or challenges with conception.
Okay,
So,
okay, okay,
stresses related to that, and they've experienced losses also.
okay, okay.
So, discussing things like that, or early pregnancy
Mhm,
generally,
mhm,
where sometimes it's a bit of a challenge that it's creating a hurdle. Just pregnancy in itself is the nausea, sickness, or other feelings related to it. There are many physiological things and a lot of hormonal changes. So that is how the group work starts like that. um, Following which, when we are talking about a full-fledged declared pregnancy, when the mother has completed the first term, uh, the focus is on educating her in the right way and helping her navigate through it in a better manner, which is
mhm.
where the concept of hypnobirthing is introduced. So
Okay,
hypnobirthing
okay.
kya hai is what is like a separate thing altogether, but that is what works very well for them. And then as the journey goes, preparing for labor and other challenges, whatever it is.
Um, जैसे आपने बताया कि देर आर अ लॉट ऑफ challenges like physiological
हम्म
challenges also and
हम्म
emotional challenges also, like as you mentioned, losses, and then
हम्म
having issues in also conceiving the conception part.
राइट राइट
So uh, how does mental health play a vital role in it? Like, I would like to give us insight, shed lights on few pointers कि किस तरीके से mentally or emotionally preparation करनी चाहिए, just like you do that
हम्म
guide through group sessions. So would you like to shed light on that
श्योर
aspect कि mentally कैसे
श्योर
prepare करे?
सो मेंटली आई मीन कोई एक फिक्स फॉर्मूला नहीं होता राइट
Right, right.
बट मेनी अ टाइम्स कैसे हो जाता है दैट पीपल आर ट्राइंग सिंस सम टाइम एंड
Hmm.
उसके बाद भी दे आर नॉट प्रोबेबली कंसीविंग और
Hmm.
समटाइम्स दे हैव एक्सपीरियंस्ड अ लॉस
Hmm. Hmm.
एंड उसके बाद इट्स अ बिट ऑफ अ चैलेंज कि पता नहीं होगा नहीं होगा अगर हो भी जाएगा विल द चाइल्ड स्टे एंड थिंग्स लाइक दैट and even the early pregnancy part where people have just learnt about it अगर previous trauma है अगर पहले के कोई challenges है या currently there are a lot of challenges then the fear or the anxiety or the stress related to it is very high. So as a result, working on your mindset, if you're, all the time that no, I don't think I'm going to walk, मुझे बाहर भी नहीं जाना है, मुझे bed rest ही रखना है, whether it's advised or not, because I'm very scared. All these things kind of need to be worked upon. Where sometimes it's okay, physiologically,
Hmm.
if everything has been ruled out by doctor, if you
Hmm.
haven't been advised specific things, we need to understand that mental health is playing a role here. वो एंजाइटी को वैलिडेट करते हुए कि आपकी फीलिंग्स वैलिड है वी नीड टू वर्क थ्रू इट दैट स्ट्रेस वी नीड टू वर्क थ्रू एंड proceed further with that. So mental health does have a huge role to play when it comes to pregnancy or conception also. Agar aap actually, and this is studies, okay, I'm not even saying this with experience only. This is studies where agar आपके stress levels बहुत high है, आपके
Hmm. Hmm.
hormone
Hmm.
levels by default थोड़ा fluctuated रहेंगे. As a result, your ovulation will get affected. As a result, you are going to find it harder to conceive because आपकी cycles regular नहीं है. आपको
Hmm.
प्लानिंग में कंसीव करने में प्रॉब्लम आ सकती है इवन आफ्टर दैट इफ आप बहुत
Mhm.
नेगेटिव सोच रहे हो या इफ यू आर गेटिंग वेरी वर्कड अप विद थिंग्स your actions will show you will be ultra careful and you will everything will revolve around just that pregnancy which will make it very
Mhm.
hard for you. So this
Mhm.
is like put in very simple words, but it actually happens to people कि इतना stress ले लेते हैं कई बार for various reasons.
Okay. Right, right. So, अभी हम जब बात कर रहे हैं स्ट्रेस लेवल्स की, so
हम्म
अभी most of the ladies are working women, like तो
right.
if if you can give few guiding pointers for working women कि किस तरीके से अपना स्ट्रेस लेवल मैनेज करे along with balancing your work and the
हम्म
personal things
हम्म
also. So yeah.
फर्स्टली ना आई थिंक विमेन अभी ना हमको सुपर विमेन बनना बहुत पसंद आता है लाइक आई कैन डू इट ऑल ओके एंड देयर इज आई मीन यू टेक प्राइड इन इट कि वी डू एवरीथिंग लेकिन आप रियलिस्टिक स्टैंडर्ड्स अपने लिए रखो कि अपनी कैपेसिटी कितनी है एंड दैट डज नॉट मेक यू एनी लेसर ओके कीप अ
Capacity.
टैब ऑन द कैपेसिटी दैट यू हैव आप कितना वर्कलोड ले सकते हो बी इट एट होम आई एम नॉट सेइंग आपका ऑफिस जॉब कम करो आई एम सेइंग दैट check what mental load are you taking about it. All right, is it compulsory mandatory कि आप 10 चीजें बनाओ for lunch dinner to prove that you are a good cook or to prove that you're a very good daughter in law or a wife? ऐसी कोई requirements है आपकी? It's also important to check आप कितना socializing कर सकते हो
Hmm.
कि मुझे तो मिक्सअप होना ही है मैं तो बहुत सोशल हूँ इफ आई एम नॉट सोशल इनफ वी नीड टू लुक इनटू आवरसेल्व्स एंड चेक अपने क्या बिलीव्स है व्हिच इज टायरिंग अस आउट शायद एक्सटर्नल रिक्वायरमेंट उतनी ना हो मे बी वी डोंट
Hmm.
नीड ऑल ऑफ दिस बट वी
Mhm.
नीड टू चेक व्हाट इज प्रायोरिटी एंड व्हाट इज रिक्वायर्ड दैट विल बी द
Mhm. Mhm.
फर्स्ट रूल. And
Okay.
then second, and I would say that should be the first rule, is your health overall.
Hmm. Hmm.
Okay, which is like a related point to the first one. uh what is suiting you here? What is it that is not giving you good results? Are you getting very tired? Are you getting mentally very exhausted? Are you
Hmm.
feeling physical health issues because of it repeatedly? जैसे hormonal issues कितने common है अभी? PCOD, PCOS, hypothyroid, hyperthyroid, these are so common. They are not
Right.
supposed to be so common, right? So हम लोग
Hmm.
कुछ तो
Hmm.
गलत कर रहे हैं. What are we eating? When are we eating? Okay. And it's not just about कौन कितना fit है, कितने घंटे जिम जा रहा है, क्या. It's not about that. It's about आप lifestyle कैसे रख रहे हो. So simple things would be your priorities, your lifestyle, and what is it that you are expecting. Having a child is also not like important. You have to think आपको चाहिए सच में एक चाहिए, दो चाहिए, नहीं चाहिए. What is it that your partner thinks? ये सारी सिंपल चीजें, वी आर जस्ट काइंड ऑफ फॉलोइंग द नॉर्म्स कि शादी कर ली है, बच्चे करने हैं, दो बच्चे करने हैं, दिस इज हाउ थिंग्स आर गोइंग टू बी, बट वी नीड टू अंडरस्टैंड व्हाट आर आवर आइडियाज फ्रॉम इट. Probably
Hmm.
that will make things better.
Hmm. 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 Right. Right. Yeah, like that is something I think we all need to consider abhi because there's a lot of change in culture also. So
Yes.
we need to adapt with the environment that is changing instead of just following the norms. So yeah, when you were mentioning about, in the previously you also mentioned about, hypnobirthing.
Hmm.
You're a hypnobirthing coach.
Hmm.
So what exactly hypnobirthing like क्या होता है and कैसे किस तरीके से वो help कर सकता है even in
Sure.
stress levels.
Sure.
Yeah.
So hypnobirthing actually is a childbirth education program.
Okay. Okay.
Okay. जो बहुत अच्छे यूनिक तरीके से डिजाइन हुआ है. राइट.
हम्म.
वो आइडियली करना चाहिए सेकेंड ट्राइमेस्टर में, आपकी 19-20 वीक्स हो जाए तभी. ओके,
अच्छा.
बिकॉज
Okay.
मूवमेंट्स आप कर सकते हो, यू आर इन अ बेटर स्पेस, आपको प्रैक्टिस करने का भी टाइम मिलेगा, और आपकी प्रेगनेंसी की यू आर लाइक समवेयर इन बिटवीन. ओके.
Hmm.
Over a period of those sessions, mothers are taught to deal with fear and anxiety that
Hmm.
is related to their experience of labor. चाइल्ड बर्थ,
Okay.
अगर मैं कई बार अगर मैं वर्ड यूज करूँ चाइल्ड बर्थ, द फर्स्ट थॉट इज बहुत पेन करेगा.
Right.
द फर्स्ट थॉट इज बहुत टफ है. ओके. इवन अगर आप कोई मूवी देखोगे, इफ यू गोना सी एनी प्रोग्राम, चाइल्ड बर्थ, दे आर गोना क्रिएट सो मच ड्रामा अराउंड इट एंड सच अ ह्यूज थिंग कि पता नहीं क्या होगा, एंड it just shows it to be like a very traumatic event. It's not that traumatic. All right.
Okay.
We are
Hmm.
getting imprinted with the ideas that it's supposed to be a huge bad traumatic experience. Just google simple videos like gentle water birth. This is
Hmm.
for everybody. Just google gentle water
Gentle
birth
water
and you
birth.
will
Okay.
be, yes, gentle water birth, and you will be so surprised कि ऐसा भी होता है. All right. And ऐसा होता है for real. You can have a peaceful experience. Some women don't experience pain. Some women may experience pain but still have a comfortable experience. All right. Pain threshold अलग अलग है सबके. So I cannot say painless होना चाहिए. कोई sensation नहीं होगी. नहीं, sensation तो होंगे. आप, you pass poop, you're going to feel some sensations. If you're going to pass a baby, you are going to feel sensations, right? So we have so many ideas, and as a result of it, we have made ourselves believe that it's supposed to be a very traumatic experience. As a
Hmm.
result, we create that for ourselves, and we create complications in a way. Okay, and plus, आपस में भी जो हम लोग discussion करते हैं are all like that only. So
Right. True.
hypnobirthing is, मतलब कैसे बात करते हैं ना कि अरे इतना ये ऐसा हुआ था,
हुआ
वैसा
था
हुआ था,
वैसा था. Right.
you know. So it helps you shorten the labor process. It acts like a painkiller. आपको बहुत सारी hypnosis based pain management techniques सिखाई जाती हैं. आपको
Okay.
right way से educate किया जाता है, so you understand how your body exactly works. Okay.
Hmm.
And simultaneously your fear, your anxiety is worked upon, so that जब आप actual में childbirth और labor आपका जब time आएगा, your body and mind are in sync and they respond accordingly. Okay.
Hmm. Hmm.
Even if, let's say, a mother has to go for a c-section and it's an emergency c-section,
Hmm. Hmm.
still whatever is learnt in hypnobirthing will support and help. Okay, your
Hmm.
transition to childbirth will be smoother. You will feel relatively better. Okay,
Hmm.
so alag breath work, visualization, positive affirmations, all these things are used over there. Okay, so that's what hypnobirthing is about.
Hmm. Hmm. Right. So, yeah, I mean, a structured method is always a great way to condition also is what I
Yes,
feel, so that
yes,
it's proven. And yeah, thank you so much for shedding light. I think this is something which is not very much talked about, and this was
right.
really a new information for me as well. So, when we are talking about just hypnobirth coaching, I was thinking about before um, the birth, before the labor. I was
Hmm.
just thinking कि किस तरीके से consulting a psychologist can also help during preparation, mentally or emotionally prepared for all these things, just like you mentioned for hypnobirthing. अगर hypnobirthing से भी पहले अगर
Hmm.
कोई सेशंस हम ले, तो किस तरीके
Hmm.
से हेल्प कर सकता है, नॉट जस्ट फॉर द वुमेन, द प्रेग्नेंट
Hmm.
वुमेन, बट ऑल्सो द पार्टनर, की बहुत सारे चीजें होते हैं ऑलरेडी, misconceptions भी होते हैं. So, do you think that everyone should consult or consider at least for a consultation, at least one consultation for getting prepared for the pregnancy and motherhood also as well?
अभी प्रेगनेंसी और मदरहुड के लिए प्रेपरेशन तो होना चाहिए. यू ब्रिंगिंग इन अ लाइफ. ठीक है,
Hmm.
हम कोई भी मीटिंग में जाने के पहले भी प्रिपेयर करते हैं. तो अगर आप लाइफ ला रहे हो अपने लाइफ में, तो प्रिपेयरिंग फॉर इट इज वेरी इंपॉर्टेंट. ओके. मैं ये नहीं कहती हूँ दैट एवरीबडी नीड्स अ साइकोलॉजिस्ट हेल्प ड्यूरिंग
Hmm.
प्रेगनेंसी.
Hmm. Hmm.
हाँ, कोई कपल्स आते हैं कि आपस में बहुत टेंशन हो गई है, स्ट्रेस है, रिलेशनशिप इश्यूज है. इसके लिए दे स्पेसिफिकली कम फॉर थेरेपी ड्यूरिंग प्रेगनेंसी. Okay, that is a different
Okay.
story.
Okay.
Okay, but for that the therapist needs to know everything about pregnancy. सिर्फ खुद के एक्सपीरियंस से नहीं, प्रोफेशनली भी पता होना
Professionally.
चाहिए.
Hmm. Hmm.
राइट. एंड मोर देन एनीथिंग, सिंपल थिंग, आप सिर्फ चाइल्ड बर्थ एजुकेशन भी करेंगे अगर प्रेगनेंसी के टाइम पे, देर आर मेनी क्लासेस. एंड नॉट जस्ट योगा क्लासेस. प्री नेटल क्लासेस आर जस्ट डिफरेंट फ्रॉम
You.
योगा क्लासेस.
Hmm.
ओके.
Hmm. 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 Hmm.
Prenatal could be like lamas, it could be hypnobirthing, it could be anything prenatal. Agar yoga class specifically they're educating also, so it's important to understand कि हम कैसे फंक्शन हमारी बॉडी करती है. नॉट इंटरनेट, इट कैन हैव अ लॉट ऑफ मिसलीडिंग इंफॉर्मेशन. बहुत सारा इंफॉर्मेशन मिलेगा, बहुत डराएगा, बहुत ट्रिकी इंफॉर्मेशन होगा. So instead, actually get yourself educated and prepare in a childbirth class to understand how pregnancy and early postpartum is going to be like. It will help you by 60-70%.
Hmm. Hmm.
Okay, and by 60-70%, I'm saying just with the process of childbirth, but 100% with pregnancy, how to go
Pregnancy.
about with things. There will be other women you may meet, or you will have an instructor, because आप गायनेक्स के पास कितना भी जाओ, they will not have the time to sit and explain things to you. वो आपको प्रोसीजर्स बता देंगे, but they will not have the time to educate you, hand hold you, आपको एक एक चीज बताना, ट्राइमेस्टर वाइज क्या क्या होगा. Now there are many apps and everything, but apps are giving you information in a different way versus an
Hmm.
educative class for
Right.
pregnancy will give you information in a different way.
Right. Right.
So it's important to prepare. आप मीटिंग के लिए प्रिपेयर कर सकते हो, तो चाइल्ड बर्थ के लिए भी करना ही चाहिए.
Prepare. Right. Okay. How the family, the partner, and their family should, support the mother, not just, अभी तो हम हमेशा से देखते हैं कि दे आर कंसर्न्ड अबाउट कि हाँ ठीक है, ये खा लो, द फिजिकल हेल्थ,
हम्म.
योगा कर लो,
हम्म.
एज यू मेंशन. सो हाउ
हम्म.
डू दे let her be, support her, and अभी ऐसा होता है कि काफी सारे ओवरवेलमिंग चीजें भी होती है कि ओके
हम्म।
ये करो, ये खाओ, ये करो, ये करो. सो हाउ टू support her emotionally, and कब
During pregnancy, you're saying?
yeah, during pregnancy.
I think during pregnancy, more or less, women are supported. There's a lot of physiological care, जैसे आपने बोला ये खा लो,
Hmm.
ये ऐसे बैठो, ऐसे करो. At the same time, simple things that partners can do is check what is the wife complaining about.
Okay.
Are there any complaints? Is she saying something? Uh, Actually, openly talk to her on a very regular basis, and even talk to
Mhm.
the baby while the baby is in the womb.
Oh,
Okay,
okay.
it helps with bonding. And just talk to the wife every day as to how can she get help in a better way.
Hmm.
Plan things for her. उसके साथ अपॉइंटमेंट्स के लिए जाइए. उसके साथ अगर इफ शी इज अपसेट बिकॉज हॉर्मोन्स की वजह से शी मे फील अ लिटिल वर्कड अप आल्सो, और एक्चुअल
Okay.
स्ट्रेसर्स वर्क प्लेस पे हो सकते हैं. It's important to understand what is it that she wants. So regular communication, not just physical support but also like conversational, in terms of regular communication or asking her what is it that they can do for her, validating her feelings. कई बार क्या होता है, हाँ बस टैंट्रम्स है, रो रही है, सब तो प्रेग्नेंट होते हैं, कुछ भी शी इज टॉकिंग, ऐसे वाला पूरा डिमीनर. वैलिडेटेड, उसको फील हो रहा होगा, इट कुड बी बिग फॉर हर, आपके लिए शायद ना हो,
ना हो.
उसके लिए होगा. Okay, so that kind of an understanding where you are being supportive from that perspective also, not just food and physical backrest and support and all that.
So if you can walk us through any kind of exercise. I'm sorry, I did not plan this question previously. It just
No, no
came to my
problem.
mind right
what
now.
what kind of exercise?
Uh, any kind of, exercise, if you can highlight upon, like maybe it can be mindfulness exercise or some related to your um, whatever you guide your clients through.
For pregnancy,
Yeah, for pregnancy.
सिंपल थिंग कर सकते हैं, ये सब लोग कर सकते हैं. For pregnancy, and you can, this is a simple form of relaxation that can be
Mm-hmm.
done.
Mm-hmm.
Okay, ensure that the couple is
Mm-hmm.
seated comfortably.
Mm-hmm.
बैक सपोर्ट आपका होना चाहिए.
Mm-hmm.
आप चेयर पे बैठे हो तो इंश्योर दैट फीट आर रेस्टेड प्रॉपर्ली. अगर
Mm-hmm.
आपने क्रॉस लेग आप बैठे हो तो नॉर्मली वैसे नेक सपोर्टेड. ऑलराइट. With that, if you're comfortable, you can close your eyes and just probably bring your focus on your head. Okay, gently as you inhale and exhale, just try to loosen up your muscles from top of the head, facial muscles, neck muscles. Okay, loosen up, and then focus on shoulders, back, and eventually do a body scan, loosening up muscles right from head to the
To
toes.
the toe.
I'm going a little faster here. Obviously, it's done process wise, aram se.
Hmm.
But just go and slowly, slowly, gently loosen up muscles. You will notice बहुत जगह पे हम contracted रखते हैं.
Hmm. Hmm.
Okay. So every day when this is done, just even before sleeping, na, it will be like you are sort of easing out your system inside. Okay,
Hmm.
and just
Hmm.
breathe in, breathe out. ये आपको 5 to 10 minutes में भी आप कर सकते हो. Even if you're not pregnant, you can do this.
Hmm.
Pregnancy
Right.
generally we do relaxation top to bottom.
Okay.
Okay,
Okay.
तो इस तरह से it's going, and this can be done by anybody. Just easing it out. This is a small, quick process which can help.
Hmm. Hmm. Yeah, that sounds soothing and relaxing.
Yeah,
Yeah,
try
even
try it on your own.
yeah, definitely. So
Hmm.
after that, like the
Hmm.
postnatal, after the childbirth, there are various challenges, issues that
Hmm.
arises.
Hmm.
um, there can be, as you mentioned, there's an anxiety also about the health
Hmm.
of the baby. Also,
Hmm.
some women also face the disconnect. So आई
हम्म
वुड लाइक टू नो कि कौन से ऐसे इश्यूज है जो आपने लाइक मोस्ट फ्रीक्वेंटली देखे, लाइक दे आर कॉमन इन मोस्टली
हम्म
कॉमन.
हम्म सबसे कॉमन इश्यू दैट पोस्टपार्टम ममास कम विद इज ना कि
हम्म.
प्रेगनेंसी में जितना केयर और प्यार मिलता था
हम्म.
पोस्टपार्टम में वैसा नहीं हो रहा.
ओके.
ओके. सो व्हाट हैपेंस इज प्रेगनेंसी में बेबी है आपके अंदर है सो यू आर लाइक होल्डिंग द बेबी इनसाइड यू. सो पूरा केयर प्यार एवरीथिंग मतलब बोलते हैं कि जैसे मर्डर भी माफ कर देते शायद उतना अच्छे से सब रखते हैं. Now that the baby is out after childbirth, the focus goes on the baby completely. Okay. And people forget the mother. Right. So that is a very hard hitting thing. From आप जैसे इतना pedestal पे रख के you are like you've just forgotten about the person. So that is one very common mistake which partners and family members make. Okay. And second thing is that which is again very common is where people want to constantly give advices which becomes like an interference and a point of frustration to the mom when it comes to feeding the baby holding the baby for everything चाहे खुद के babies हो ना हो. But that constant advice maybe people are trying to be helpful or they wish well but it can be very frustrating for a new mom. Okay. So ये दो बहुत कॉमन चीज है. एंड अदर देन दैट व्हाट आई हैव कम अक्रॉस इज यस पोस्टपार्टम डिप्रेशन एंड एंजाइटी. कुछ उससे मैसिव एकदम से बहुत रेयर होता है बट फॉर दैट देन दे नीड मेडिकेशन. Alright, but postpartum depression and anxiety is something that I have come across more common. Like that's more common for me.
ओके.
Hmm.
तो सो इफ यू कैन गिव सम साइंस जो हम कंसिडर कर सकते हैं, इवन द मदर एज वेल एज द पार्टनर और द फैमिली की, ओके, दिस बिहेवियर इज समथिंग विच शुड बी एड्रेस्ड and
Mhm.
we need help from a professional.
Hmm.
So if you can give just a few signs ki we should
Sure.
consider professional.
Sure. एक बहुत important चीज है that there is a difference between postpartum blues and actual postpartum other mental
Depression,
health
yeah, issues,
challenges.
yeah,
Okay, depression majorly और
majorly
anxiety या जो भी आप
anxiety.
consider करें. First let's say for a 3 to 4 weeks, first 2 weeks especially, but I'm just taking like a roughly 1 month guideline. अगर first month में if there is a lot of crying from the
Mm-hmm.
mother's side, she feels very uncomfortable, very detached, or her appetite is very changed, or she's showing a lot of anger, or she is showing a lot of withdrawal, not being with people.
Mm-hmm.
ऐसा कुछ भी अगर हो रहा है तो फर्स्ट मंथ में it is usually okay. It's postpartum blues. Her body chemical levels are shifted, everything is different. But by chemicals I mean your hormones and other
Hormones.
fluids, everything else that is
Mm-hmm.
shifted and changed. Physical recovery हो रही है. Now if this continues in the second month also, 2.5 months पे भी if you notice that there's a lot of crying, there is a sleep deprivation ऐसे भी होता है but उनको नींद ही समझो नहीं आ रही है. या
अच्छा.
फॉर
Okay.
इंस्टेंस उनका एपेटाइट बहुत शिफ्ट हो गया वो खा नहीं पा रही हैं बिल्कुल या शी इज ईटिंग वे टू मच or she's
Mm-hmm.
having massive issues when it comes to हर छोटी चीज पे इरिटेट हो जाना या झगड़ा ज्यादा हो जाना या completely साइलेंट जोन में चले जाना या नॉट फीलिंग दैट कनेक्शन विद द बेबी या वो खुद कंप्लेन करे कि मुझे बहुत नेगेटिव थॉट्स है या
Mm.
सेल्फ हार्म गॉड फॉरबिड करने की
Okay.
कोशिश करे या
Okay.
सेज दैट आई डोंट लाइक द चाइल्ड या थिंग्स लाइक दैट. अगर ये 5-6 वीक्स के बाद भी आपको परसिस्टेंट दिखे तो प्लीज
Mm.
सीक प्रोफेशनल हेल्प.
Mm.
कई बार ये सारे सिम्टम्स इतने प्रोनाउंस नहीं होते. यू कैन नॉट सी मे बी दे आर नॉट गेटिंग एंग्री, मे बी यू जस्ट फील कि अच्छा शी इज रेस्टिंग शी इज क्वाइट. बट इफ शी इज अनयूजुअली क्वाइट प्लीज लुक इनटू इट. मे बी शी नीड्स हेल्प. सो आइडियली आफ्टर 4 weeks कीप अ टैब. बट क्या हो जाता है कई बार अपने यहाँ पे बहुत सारे जन आते जाते हैं एंड ऑल्सो इट्स अ लिटिल ओवरवेलमिंग. Now,
Mm.
even after 2 months or so, if this still persists, it's important to seek help to understand that, she needs support, and एक session से कुछ नहीं होगा. You need some work, and
Hmm.
only then, and maybe medication can get involved depending on her condition. But yeah, you will have to go to somebody who understands postpartum mental health. Every psychologist is not equipped
Want
to
to
deal
be,
with postpartum.
yeah, yeah. And
Yeah.
you do take the sessions for postpartum
Yes, that's right.
preparation as well,
That's right.
right?